Hello, and welcome to Colores Latinos TV. I'm Nancy Peña. As you know, Colores Latinos TV is a monthly and bilingual show that brings to you important topics such as health, education, and culture. Today we have a very important topic that we will discuss and learn. We have Dr. Steve DeFosses, who is going to help us to understand more about the drug abuse crisis that we are facing every day, as well as what is the Safe Injection Facility Project. According to the epidemic reporting to America's prescription drug abuse crisis, prescription drug abuse is the nation's fastest growing drug problem. While there has been a marked decrease in the use of some illegal drugs like cocaine, data from the National Survey of Drugs Use and Health, known as NSDUH, show that nearly 1/3 of people aged 12 and over who used drugs for the first time in 2009 began by using a prescription drug non-medically. The same survey found that over 70% of people who abuse prescription pain relievers got them from friends or relatives, while approximately 5% got them from a drug dealer or from internet. Although there has been great strides in raising awareness about the dangers of using illegal drugs, many people are still not aware that the misuse or abuse of prescription drugs can be dangerous as the use of illegal drugs, leading to addiction and even death. So today, Dr. Steve DeFosses will help us again to understand more about. Welcome to Colores Latinos TV, Dr. Steve DeFosses.
Thank you, Nancy.
Thank you. So my first question is, what is an addiction?
Well, addiction, we've come to understand, is a physical disease of the brain. It's not a moral failing. It's not a personal weakness. People sometimes start using substances, whether it's drugs or alcohol, or even behaviors like gambling, as a small part of their life that they might enjoy. But over time, for some people, it becomes an all-consuming central component of their life, which squeezes other important parts of the life out. For example, when people gradually go from participating in an activity to addiction and develop a physical disease we know as substance use disorder or addiction, it can negatively influence their relations with their family and friends, and they can actually become estranged from their family and friends. It can negatively influence their relationship with their jobs and work, and they could actually lose their jobs. And in extreme versions, it can even influence and negatively affect their relationship with their home. And sometimes people can become homeless because, as the brain is diseased, part of the disease of addiction is altered decision making, and they see obtaining the substance or what it is they're addicted to, this craving is so strong, and sometimes the pain of withdrawal, if they're not getting it, so painful that that's the focus of their life. Now, these people have a physical disease. It's a chronic, we call it in medicine a chronic disease, which means long-term disease, just like hypertension, just like diabetes. And there are treatments, effective treatments for this chronic disease. We call them medication-assisted therapy that can physically alter and improve those things in the brain that are diseased. Now, when people are on long-term medication-assisted therapy, they may have relapses, and that's true in diabetes, that's true in high blood pressure, and that's true in opioid substance use disorder. But we have treatments, and the important thing for our audience to understand is if you know someone who has this disease of opioid addiction, there are treatments that are effective, and these treatments will reduce their cravings, and they will eliminate the withdrawal pains which drive so many people to continue to use these drugs.
Can a person who started using prescriptions, for a painkiller, like you mentioned before, later can become an addict?
Yeah, I actually don't like to use the word addict because we know these are people with a disease. And the word addict, although I know you mean it scientifically, some people use it, in a way we call pejorative or negative, as if it's somehow a personal failing of the individual. So I prefer to call people who are addicted to these substances people who have, what we understand is a disease, substance use disorder. Anybody can develop opioid substance use disorder, which is addiction to narcotics, such as pain pills that you're referring to, like codeine or morphine or oxycodone. Some people are more likely to develop an addiction than others. It depends on our genetic makeup. But anybody can become addicted. And your brain cannot differentiate between a prescription pain medicine that has narcotics and an illegal street drug that has narcotics. To your brain, they all trigger the same effects in terms of euphoria or pain release or triggering withdrawal pains. And so there are certainly people, and I can tell you stories if you like, who through no fault of their own were patients who were exposed to narcotic pain pills and then became patients with substance use disorder, sadly.
Okay, can you share one of those stories? Because I remember that when we were working in the pre-production, you mentioned a couple stories. So perhaps I think it's important for our audience to get, those stories. So maybe people can identify themselves with those stories.
Yeah. People can get their first exposure to narcotic in a medical setting, and that's the story I'll tell first. There was a police officer in a town in central Massachusetts who was a husband, a father of children. His children were in junior high school and high school. He was a volunteer in the schools, a volunteer baseball and football coach, and he happened to be a highly decorated police officer. He was the number 2 police officer in his police department, and in fact he had gotten national training in Washington, the FBI, and been decorated not only locally but by the FBI. He was, by all accounts, a pillar in his community. But he had shoulder pain, and he ultimately ended up getting a type of surgery we call rotator cuff surgery. And after the rotator cuff surgery, his doctor gave him a bottle of pain pills and said, when you go home, when you have pain, you can take a pill every 6 hours or so, and it should get better over the course of the next week or two. Well, when he got home and he took his first pain pill, he said it was the best feeling in his life. It was better than his marriage day. It was better than when his children were born. He couldn't get over the euphoria he experienced when he took that pill. That wasn't his fault. He didn't do anything wrong. It's just his genetic makeup, the actual DNA of what, that codes the cells to develop into his body instead of yours or mine, what he was born with, was very predisposed to enjoy the feeling of opioids. So when he took that first pill and he enjoyed it so much, he couldn't wait till 6 hours went by so he could take the next pill. And then when he took the next pill, he got that same euphoria again. And so over a period of days, he enjoyed those pills so much. And when the pill bottle ran out, he told the surgeon, I have pain, I need more of those pills. And he did have some pain, but he was really enjoying the euphoria of the opioids. When the second bottle of pills ran out, his surgeon said, you don't need him anymore. It's been long enough after surgery. Tylenol would probably work for you. And he weaned himself off the opioids, went back to work, and for 2 more years he was an upstanding pillar of his community. And after 2 more years he had a second surgery, another joint problem. And when he came out of surgery and he took that first pill, he was addicted. He just couldn't stop taking the pills. And so when he ran out of the pill bottles and his doctor wouldn't give them anymore, even though he was a police officer sworn to uphold the law, as I said, when you have substance use disorder, it affects your decision making. And so he began to obtain narcotics illegally. Ultimately, he was caught stealing narcotics from the police evidence room. He was tried before a judge. He admitted, as soon as he was caught, he said, "Thank God you caught me. I'm on this roller coaster. I can't stop." He was brought before the judge, and she threw the book at him because she said, "You're a police officer. You should know better." And so he served time in jail. When he was in jail, he went through, detox, and now has now is fully in recovery on medication-assisted therapy, and he actually is a public speaker and a recovery coach helping other people. But the point of the story that I think is critical is it wasn't his fault. He didn't even make a bad decision. He was given these pills, and the genes that he was born with made him become addicted to this and develop substance use disorder. And once you have a disease, the decisions he made thereafter were altered by the fact that his brain was affected. If I could just tell you another brief story.
Please, yeah, it's important. Yes.
It's the story about me. A number of years ago, I had a kidney stone. And I stayed home as long as I could, hoping to pass it, but eventually the pain got to be so excruciating, and any of the audience who've had a kidney stone understand what I'm talking about. I ended up going to the emergency room. And I'm a doctor, so I pretty much knew I had a kidney stone. I said, I'm in a lot of pain, I'm having a kidney stone, can you give me some narcotics? And you can imagine they looked at me like, right. But they took me in to get a CAT scan, I had a kidney stone, and they put the medicine in my vein. And when it first passed through my body, I felt this, they call it a head rush or a rush. I felt this thing in my head. I didn't like it at all. And then the pain went away. So it was effective pain medicine, but what I felt, I didn't care for. It was a little nauseating. I didn't, but what this police officer felt was euphoric. Had I felt euphoria and he felt nausea, I might have been the one who was arrested and convicted and thrown in jail. Neither of us chose how we reacted to that medicine. It was something we were born with.
I think it's sometimes to understand a little bit more better how people can start using legal drugs and lead to illegal or abuse substance, right? That's the best example you described, that sometimes people go to the doctor because we have a pain or we have a surgery. And after surgery, usually we are being prescribed narcotics, and it's very common. So it's something that is happening every day. My next question is, after you describe that, how important is the role of the doctors in educating patients about prescriptions that perhaps in the future can lead to an addiction?
Well, that's a great question. It turns out America has less than 5% of the people in the world. We're less than 5% of the population in the world. But we consume 80% of the world's opioids. That's way out of whack. And so you have to ask yourself, why is that? And we in the medical community have come to realize how dangerous these drugs are. They're killing 91 people a day in the United States. They're highly dangerous, highly addictive. And in fact, the evidence that they can treat or cure chronic long-term pain is little to non-existent. But we in the medical community were sold a bill of goods by the pharmaceutical companies about 15 years ago. We were told these medicines were safe and effective, and we believed it, and we prescribed them too much. And so, I'll give you another example. My son had his wisdom teeth out. And after he had his wisdom teeth out, they gave him a prescription for pain pills. He went to the pharmacy and got the bottle filled with pain pills, and he brought them home. Nobody told him these are dangerous. Nobody told him that he could become addicted, like that police officer I told you about. This bottle of pills, as I just described, how it destroyed the life of this police officer for a number of years, this bottle of pills is as dangerous as a loaded handgun. And we've got to treat it like a loaded handgun. Historically, we haven't done that, which is part of why we have this problem. So I told my son, since I'm working in the field, if you really have a lot of pain, you might need one of those pills, but you don't need a whole bottle. It turned out he took Tylenol. He didn't take any of those pills. And now we have a bottle of pills that we have to get rid of. Sadly, a lot of us, when we have leftover pain pills, put them in the cabinet in case we have another episode of severe pain, we can use them. But if they're in the medicine cabinet, they're available for someone else to take. And again, a bottle of pills is as dangerous as a loaded handgun. You wouldn't leave a loaded handgun where strangers, where children, where other family members could just pick it up and play with it if they weren't trained. And yet that's what we do with these things. In fact, the worst place in your house to put a bottle of narcotics, if you happen to have a prescription of narcotics and are using them appropriately, the very worst place to put them is in the one room where someone can close the door, lock it, and then rifle through your stuff to look to see, if you have narcotics. And the only room in your house where that can happen is the bathroom. So if you do have, a need for prescription narcotics and you have them in your house, please don't leave them in your bathroom. Please put them somewhere else so that in case one of your children or friends is in the bathroom, they don't get tempted to take these and either sell them for a profit or try them at a party. The other issue is when you're done with them, please don't save them for a rainy day. When my son no longer needed these narcotics, we got rid of them. And there's a lot of different ways to get rid of them. You can bring them to a drug disposal box, but the easiest thing for everybody to remember is you just dump them in the toilet. They're gone. And so I'd encourage everybody to look in their medicine cabinets. If you've got these dangerous, addictive, and deadly things in the medicine cabinet, just dump them down the toilet.
You mentioned that the pharmaceutical industry say that those medications, that prescriptions were saved. How about now? We are learning that they are not safe anymore?
Well, we know they're not safe because 91 people a day are dying from opioid overdoses. Some of that is from prescription pills. Just when people take pain pills over time, their body becomes what's called resistant, or they develop a tolerance. So when initially you might need one pill to relieve that pain, later on you might need 2 pills, and then 3 pills. And eventually you might need so many pills that it becomes a lethal level, where if you took that many pills to treat the pain, you would stop breathing and die. And sadly, every day people are dying from pills that they were prescribed that the doses are too high. A larger percentage of people right now are dying from intravenous drug use, heroin, and often what's made it so lethal lately is that people that sell the heroin are mixing it with a drug called fentanyl, which is much more deadly than heroin. Most of the people that use heroin today, when they come into the emergency room with an overdose, roughly 80% of the people, if you ask them how they were first exposed to narcotics, they will tell you a prescription pain pill. And that prescription pain pill wasn't from a doctor, it was from a friend or a relative, often at a party. And so you might, ask me, are these people somehow, did they make a mistake? Is that how they ended up becoming addicted to the substance and have full-blown substance use disorder and now are, using heroin every day? And, I'm sure they would tell you it was a mistake. But who amongst us hasn't made a mistake? Who amongst us hasn't made a bad decision, particularly when we were young? It's just fortunate for us that the bad decisions we made didn't develop into a full-blown dependence on a substance and a full-blown disease called substance use disorder. But what I'd like your audience to remember is that this disease is treatable. People can go into recovery. They can regain the opportunity to have a job and family and friends and a home. And the treatment, these medication-assisted treatments, some of them you may have heard of. There's a drug called methadone, which can treat people. There's another drug that people can take in their own home called Suboxone. There are multiple different medications that people can use. Some of these are now being developed that can extend over time, so you don't have to take them every day.
We understand that when we are going to see the doctor, you are a doctor, I'm not. I can be a patient, a regular patient. So usually when we go, we know that sometimes you just, as a physician, you just have perhaps 15 minutes for each patient. It depends what is your role or what kind of facility we are going. So when we go, sometimes we see the doctor, in a rush, and we don't have time to have a conversation, at least to discuss, for example, how dangerous are those prescriptions. So my question is, how we can have that conversation, how we can ask the doctor, and for the doctor to pay attention to us about how dangerous is the narcotic of the prescription we are having for pain. And Dr. Defese is going to answer that question after this pause.
Taxi!
Si no puedes hacerlo todo, haz lo que puedas. La compasión por los demás, pásala. Un mensaje de la Fundación para una Vida Mejor.
Hello and welcome to Colores Latinos TV. If you just turn around your TV, just want to let you know, then today we have a Dr. Steve Deficit, who is helping us to understand more about substance use as illness and also to learn about safe injection facility project. My last question, doctor, was about how we can ask our doctors when we are going for an appointment or follow-up, how we can ask if the prescription he or she is prescribing to us is going to be danger and is going to lead us to an addiction.
I think that we as prescribers, whether we're nurses or doctors, have an obligation to talk about the risks and the benefits of the medicines when we share them with the patients. If for some reason we don't do that, patients ought to ask, is there something I should be concerned about? Is this a dangerous medication? And similarly, the pharmacy where the medication is picked up, pharmacists sometimes know more about the side effects of these medications than doctors and nurses do. And so I'd certainly encourage patients when they pick up the medicine from the pharmacy to talk about the risks and benefits of really every medication they take. Is it safe to take with other medications that they're on? Is it safe to take with other foods? It's a very straightforward question. Pain medication in particular, people should think about, is this a pain medication that's a narcotic and therefore addictive? Or is this a pain medication like Tylenol or aspirin that's not a narcotic and not addictive? Patients should understand that when they leave the doctor's office, and they should certainly understand it when they have that bottle of pills in their hands.
Thanks. How about women in pregnancy? How that can affect, for example, if we have a woman that is using illegal drugs or perhaps legal drugs, how that can affect to the baby and the woman itself?
Well, it's a great question. Most medicines cross the placenta from the mother's bloodstream to the baby's bloodstream. So if you expose yourself to alcohol or tobacco, with the nicotine in the tobacco, or most medications, the baby will experience those medications as well, which is why we encourage people not to drink alcohol when they're pregnant, not to smoke when they're pregnant, because in fact, and particularly at higher doses, alcohol can result in harm to the baby. Fetal alcohol syndrome, where the baby's whole life is affected by the mother's consumption of alcohol. Cigarette smoking can result in premature births, smaller babies, and even at times miscarriages. These narcotic opioid medications that we're talking about cross the placenta, whether it's a legal one, like a pill that you get from a doctor's office, or an illegal one, like heroin or fentanyl that's injected. And just like parents, adults become addicted to these medications, the unborn baby becomes addicted to these medications. And so sadly, there's been a skyrocketing level of babies born to mothers who have opioid substance use disorder, who when the babies are born, then go into withdrawal. And that's painful. It can result in fevers and crying and diarrhea. And so instead of going home with the mother in a day or two, these babies need to go through a withdrawal or detoxification, which often is over a week in the hospital. And so to the extent that mothers who have issues with substances can discuss that with their treatment provider, whether it's a nurse midwife or an obstetrician, they can get help. Any medication, if it's necessary for the mother, should be looked at in the light of, is this going to be harmful to my baby? Should I try a different medication? Okay. So these are conversations women should have with their doctors.
Well, we are, as I mentioned at the beginning, we are trying to understand substance use as illness. And my question for Dr. Deficit is how about people who doesn't have any pain, who decided or choose to consume A, B, and C drugs? Are we still thinking that they are having some issues in the brain?
Well, what I would say is we're all different. We all have different genes. We have all different predilections. Some of us are predisposed to get back injuries. Some of us are predisposed to have mental illness. There are risk factors that make you more or less likely to develop opioid substance use disorder if you're exposed to it. If your parents are people who have opioid substance use disorder, you're 8 times more likely to develop it yourself if you're exposed to it. if you have post-traumatic stress syndrome, if you're addicted to other substances like alcohol or tobacco, if you have serious mental illness, all these things can predispose somebody to develop opioid substance use disorder. As I said in the beginning of the program, we talked about someone who, through no fault of their own, was exposed to opioid substances through medical care, and they became addicted. Sadly, lots of people are exposed to it at a party where someone offers them a pill, and some of us are predisposed to enjoy that and to want to do it again and again and develop substance use disorder. Some of us are less genetically predisposed to that. It doesn't mean that those of us when we were in high school that made a bad mistake and it didn't affect us are any better than those of us who made a bad mistake and actually develop full-blown substance use disorder. The bottom line is, when someone is addicted to substances, they have a chronic medical disease, and we can help with that. And if we don't help with that, it's very expensive for a society. It's much less expensive to treat somebody with opioid substance use disorder than it is to ignore them and let them run through the criminal justice system, the crime that's associated with it, the harm, the loss of work, the loss of jobs, etc.
When we open this episode, we mentioned that we will talk about safe injection facility. We are going to have a couple questions with Dr. Deficit, but we will produce another episode to continue the conversation. As you know, this is a crisis that we are facing every day, and the topic is a very interesting topic, and it's a long conversation. So we are going to try to bring to you the second episode. But before we finish with this first episode, Dr. Deficit, what is the goal behind the safe injection facility?
As I said, I want people in the audience to understand that people with opioid substance use disorder can be treated. But not everybody with opioid substance use disorder wants to be treated today. But that doesn't mean we can't help them. We in the medical profession have a moral obligation to treat everybody with respect and compassion. And one of the treatments, if somebody doesn't want to go through detox and wean themselves off opioids and onto a medication-assisted therapy as an alternative to going through withdrawal, we can still help them survive. People who overdose in private by themselves can't survive. Ultimately, in the long run, most people with substance use disorder will choose recovery, but dead people can't choose to recover. So it's our obligation to offer these people what we call harm reduction strategies to help them survive until such a time as they choose recovery. And there's a lot of harm reduction strategies, some of which you've probably heard of before, such as clean needle exchange, because while somebody decides that they're not going to go into recovery today, if they take a needle with hepatitis or AIDS and inject themselves, now they've got two diseases and two problems. So at least if we can help them to have one disease, it's better than two.
And so, for example, when you mention, I know we are almost closing this interview, but I just want to ask you, if people want to learn more about this information, what is the best way to reach you?
Well, you can reach me directly through my website, which is defosays.com, and I'd be happy to connect anybody with resources in their community. I'd be happy to connect any providers with a whole host of resources that are available.
What is your advice or recommendation to our audience about how to prevent not to use or not to become substance use disorder? How to prevent that? What is the recommendation?
We should have two big problems in society. One is to treat the people who have addiction. We've just been talking about that. And the other is to prevent people from becoming addicted to these substances. The best thing we can do is turn off the spigot of all these pills that are available. So when you are a patient, ask your doctor for the smallest number of pills available. Ask for alternatives to pain medication. If, for example, that person with rotator cuff surgery, instead of having a bottle of opioids, was offered Motrin and massage therapy and physical therapy, he'd never have gone to jail. And so ask for alternatives to the opioids. and ask for as little as possible. And when you're done, get rid of those pills, destroy them. Bring them to a drug take-back center. You can put them in your garbage. You can flush them down the toilet, but don't leave them in your house, because if you leave them in your house, statistics will show that they're going to end up causing other people to be addicted, and 91 of those people a day are dying.
Okay.
And these people are not somehow inferior to us or somehow bad people. They're our brothers and sisters,
exactly.
mothers and children.
Exactly. Well, we definitely appreciate your time today here in Colores Latinos TV. Remember, if you want to watch this interview, you can visit us in our YouTube channel, Colores Latinos TV. Also, you can write us at coloreslatinostv@yahoo.com and check it out our website at www.cltvs.com. We are going to provide some websites, national websites, that you can check and learn more about this crisis we are having. And remember, you are watching Colores Latinos TV. Thank you.